Hi, I'm Michelle Ginsberg. I'm Director of Cardiothoracic Imaging and Vice Chair for Education at Memorial Sloan Kettering Cancer Center. And I'm also a Professor of Radiology at Weill Cornell Medical College. If a patient is diagnosed with lung cancer on a chest X-ray, generally the next step would be to obtain a CT scan of the chest, and preferably with intravenous contrast. Intravenous contrast helps to delineate vessels and separate the tumor from the adjacent structures and also identify lymph nodes better from the surrounding structures. So ideally, the first step is a CT of the chest with intravenous contrast. The next step would probably be a PET CT, which demonstrates uptake in other parts of the body besides the chest throughout the entire body. So if we're looking for metastatic disease, it's helpful because you may find out lesions that are occult throughout the rest of the body. Now, a brain MRI with contrast would be obtained in patients that have stage 2 or 3A tumors, and recommendation is that it's optional for stage 1B tumors. Other studies that could be obtained would be, for example, an MRI of the spine with contrast in those patients that have a specific type of tumor that's called a superior sulcus tumor, and it basically abuts the spine and vessels. And it's important to know if there's invasion of these structures. So an MRI of the spine in those cases would be helpful. Now, it's helpful to do concomitant staging because it avoids additional biopsies or procedures. So it's preferable to biopsy the lesion that would upstage the patient. So for example, if you get a PET CT and you see the primary lung tumor, but you see a lymph node contralateral or somewhere more distally, it would be helpful to biopsy the more distant lesion because that would upstage the patient instead of just a lung tumor and not know if the mediastinal lymph node is involved or not. Similarly, if there's a liver lesion or bone lesion, it would be, and it shows up on the PET CT, it would be helpful to biopsy that lesion because then you know that it is upstaged. Now, decisions about the optimal diagnostic steps are best done if they're done in a multidisciplinary approach, meaning that you involve thoracic radiologists, interventional radiologists, thoracic surgeons, and probably, if needed, a pulmonologist to see which would be the best location to sample and which way to sample it. It's not always done just percutaneous in radiology. It may be done by the thoracic surgeon or via bronchoscopic techniques by both surgeons and pulmonologists. So PET CT in these cases is helpful because it identifies other sites which may upstage, as I mentioned, or may find sites that are easier to localize due to proximity, let's say, to the let's say a bronchus, or if that's being done bronchoscopically.